It's 2 a.m. and you can't sleep. You are terrified that you might have caught HIV from oral sex. If that is you, I need you to do two things right now. First, put down your phone. And second, listen to me. I am Abhishek, a specialist pharmacist in HIV and sexual health. And I have sat across from thousands of men who are worried about the exact same thing you are. So in this video, I'm going to do more than just tell you that the risk is low. I'm going to prove it to you using the biology of your own mouth. So let's look at the facts. To understand the risk, you have to understand the virus. HIV is actually a very fragile virus. For HIV to infect you, it needs a direct route into your bloodstream. In anal or vaginal sex, the friction can cause micro tears that act like an open door to the virus. But your mouth is built differently. The lining of your mouth and throat is a thick, multi-layered mucous membrane. It is designed to withstand chewing, hot food, and bacteria. And here's the coolest part. Your saliva is a natural antiviral. It contains something called secretory leukocyte protease inhibitors, SLPI. That's a fancy medical term for proteins that actively attack and neutralize the HIV virus. This is why, statistically, the risk of transmission from oral sex is classified by the CDC or the NHS as low or negligible. But low is not zero. So let's talk about exceptions. We need to split this into two categories: giving and receiving. The risks are not the same. So let's look at both the scenarios. Scenario A, you received oral sex. You were the passive partner. If you're a man and you received oral sex, the risk of acquiring HIV is effectively zero. Why? Because saliva does not carry HIV. Even if your partner has HIV, their saliva is not an infectious fluid. The only way, and I mean the only theoretical way, you could be at risk is if your partner had significant bleeding in their mouth, like fresh tooth extraction or open gum sores, and that blood entered your urethra. In 17 years, I have seen almost zero credible cases of transmission this way. Scenario B is you gave oral sex or you were the active partner. This is where the anxiety usually comes from. If you performed oral sex on a man and he ejaculated in your mouth, is there a risk? Theoretically, yes. Semen does carry the virus. If you swallow it, or if it sits in your mouth, you are introducing virus to your body. However, because of those enzymes in your saliva and the acid in your stomach, the virus is usually destroyed before it can infect you, but usually isn't always. So when does the risk spike? There are three specific factors that turn negligible risk into a real risk. Number one is the open door policy. Does your mouth have an open door? I'm talking about mouth ulcers, herpes sores, a throat infection, or bleeding gums from flossing too hard. This reminds me of a common mistake I see. Patients tell me that they brush their teeth aggressively right before a date to have fresh breath. Don't do that. You just created thousands of microabrasions in your gums right before exposure. You actually increased your risk while trying to be clean. Number two is viral load. Now, this is the most important one. If your partner is HIV positive, but on medication and undetectable, the virus in their body is suppressed so low that they can't pass it on, period. We call this U equals U or undetectable equals untransmittable. The danger comes if your partner has just been infected within the last few weeks and doesn't know it yet. Their viral load will be sky high. We call it primary HIV infection, making them highly infectious. Number three, the other infections. Here's the plot twist. You are worried about HIV, but you should be worried about gonorrhea and syphilis. These bacteria love the throat. Antibiotic-resistant gonorrhea is rising, and you can absolutely catch it from oral sex. So if you wake up 3 days later with a sore throat, don't assume it's HIV. It's far more likely to be a bacterial sexually transmitted infection that we can cure with a simple treatment. So don't let your mind jump to the worst case scenario. So what do you do now? Let's divide it into two phases. If you had a high risk encounter less than 72 hours ago, meaning your partner is known to be HIV positive and not on treatment, or you're just unsure, you have a 72-hour emergency window. Go to a sexual health clinic and ask for PEP, post-exposure prophylaxis. This is a month-long course of HIV medication that stops the virus from taking hold in your body. It is effectively a morning after pill for HIV. But you have to move fast because every hour counts. If the exposure happened more than 72 hours ago, PEP is no longer an option. Now we wait. Do not rely on a test you take tomorrow. It will be negative and it will be false. Modern fourth-generation blood tests look for the virus and the antibodies. They are incredibly accurate, but only after 45 days. So mark it in your calendar, get tested at 45 days. If it's negative, you're negative and you can move on with your life. Here's the bottom line. Sex should be about connection and pleasure, not panic and anxiety. The best way to optimize your sexual health isn't to live in fear. It's to know the facts and get tested regularly. So, if you found this video helpful, do me a favor and hit the subscribe button. I'm building a community here for men who want to optimize their body and their health without the judgment. Whether it's gym supplements, hormones, or sexual health, I'm here to give you the science. So stay safe, stay optimized, and I'll see you in the next video.